Hello, I am Dr. Jaquetta Fushi, a psychiatrist, wife, and a mom. The COVID-19 pandemic is creating a lot of understandable fear, anxiety, and worry. These feelings are especially difficult to manage for people with pre-existing mental health conditions or substance use disorders. I want to share some things that you can do to minimize the mental health effects of COVID-19. If you or a loved one are experiencing increased anxiety, depression, or a behavioral health crisis, please reach out for professional help. Remember that social distancing doesn't mean social isolation. Check on your family and friends. Make sure that you minimize your risk of contracting COVID-19 with these simple tips. Wash your hands for at least 20 seconds using soap and water. If you must go out in public or crowded places, maintain at least 6 feet between you and other people. And wear a mask or protective face covering that covers your nose and mouth when out in public. Remember, we are all in this together. Let's take care of ourselves and each other. For more facts and information about COVID-19, visit www.nc.gov/COVID-19 or call 211.
Good morning, everyone. My name is Okira Harris. I serve as the Assistant to the Director of Public Engagement at the Office of the 75th Governor of North Carolina, Governor Roy Cooper. This is our 11th weekly webcast, and today we will focus on racial equity and unpacking North Carolina's stay-at-home order. We encourage you to engage with us via the YouTube and WebEx stream chat rooms where you can submit questions real time. There are epidemiologists standing by to answer health-related questions, as well as government agency professionals to answer any leadership questions you may have. During our program today, we will hear from Mr. Benjamin Money, Deputy Secretary from the North Carolina Department of Health and Human Service, Ms. Caroline Farmer, Director of the Office on Volunteerism and Community Service, and Mr. Jeremy Collins, the Director of Public Engagement. Again, I want to thank everyone for being with us today. We want to make sure you have up-to-date information. We also encourage you to visit the North Carolina ncdhhs.gov/coronavirus website, where you can find additional resources and information. With that said, I invite Deputy Secretary Benjamin Money to the stage. Thank you.
Thank you, Akira. Good morning, everyone. I want to thank you for joining us today for this important update. We appreciate your regular attention to the COVID-19 pandemic and your efforts at keeping yourselves and your neighbors safe. In the past weeks, you know I've discussed social distancing and how it's helped us successfully flatten the growth curve of COVID-19 infections. Unfortunately, we're now starting to see our trends head in the wrong direction. Yesterday, there were 38,171 laboratory-confirmed cases of COVID-19. There were also 780 people currently hospitalized with COVID-19. And sadly, there have been 1,053 deaths in North Carolina due to COVID-19. It was another high day of cases and hospitalizations for the state. And it was our fourth day in the last week where we exceeded 1,000 cases and our highest day yet of hospitalizations. So again, we continue to be very concerned about this trend. Remember, I've talked about testing, tracing, and trends are really going to be driving our decisions. Well, our trends aren't heading in the right direction. And this is true for many of our neighboring states in the Southeast. They're seeing similar trends. It's a reminder for all of us that COVID-19 is still a dangerous threat and that this virus will be with us for some time. But remember, there are some clear steps that we can take to protect our loved ones and our neighbors and ourselves to slow the spread of this virus. The first step and our core strategy is to reignite the economy is to practice the 3 W's. That is, wear a face covering, wait 6 feet apart, and wash your hands frequently. We need to take these actions every day, every time. This virus continues to spread by people who don't know that they have COVID-19. Remember, wearing a face covering stops you from unknowingly spreading the virus to others. This is your way of demonstrating that you care for other people. If we can all take this simple but meaningful action, we can help to curb the spread of COVID-19. Second step is testing. We want to make sure that you get tested and stay home and away from others if you have or have been exposed to COVID-19. We're continuing to ramp up our testing, and in the last month, we've had more than tripled our daily testing averages. We've gone from 5,000 per day to now 15,000 per day. We also have increased our testing sites. Right now, we've got about 400 testing sites listed on our website, and we need to make sure that people are getting tested and are getting to those sites. We now have an online symptom checker on our website that allows people to input their symptoms as well as their county and zip code and access a list of nearby testing locations. And on Tuesday, we shared our updated guidance with physicians and other healthcare providers on who should be tested for COVID-19. Again, we want to rapidly increase our testing for people who may have been exposed to COVID-19 but do not have symptoms, but especially people from historically marginalized populations who've been disproportionately impacted by COVID-19. We know that Latinx cases are increasing. The Latinx community in North Carolina represents 10% of our population, but over 40% of the lab-confirmed cases where race is identified, and 7% of the deaths. African Americans represent 22% of North Carolina's population and 27% of lab-confirmed cases, but 33% of the deaths. So at DHHS, we've organized ourselves across divisions and brought in statewide partners to create a historically marginalized populations work group. Focus of our work group is on effectively reaching and engaging historically marginalized populations to provide COVID-related prevention education and guidance to prevent the spread of COVID-19 and to mitigate COVID-related mortality and morbidity. We're also focused on connecting people to medical and behavioral care providers that deliver care regardless of a person's ability to pay. Also linking people to needed resources to address social determinants of health, things like food, shelter, transportation, interpersonal violence. We want to make sure that people get the resources they need while they are dealing with COVID-19. Also, a big part of our focus is on protecting essential frontline and undocumented workers from exposure to and infection from COVID-19. We know that people in historically marginalized populations are disproportionately represented in these professions, and these professions cause individuals to have a greater degree of exposure due to the frequency of new individuals that they encounter every day as a result of their work. We also want to assure that COVID-related contracting activities at DHHS seek vendors from North Carolina's historically marginalized communities and businesses. In addition to the historically marginalized populations, we want people who live or work in these high-risk settings like long-term care facilities, correctional facilities, or in settings where they have a higher risk for exposure, like grocery stores, food processing plants, and child care, to also get tested. And anyone, and this is important, anyone who's attended a mass gathering, including a protest, should also get tested. The third thing we all need to do is answer the call. If you get a call from the local health department, answer that call so that others that may have been exposed can get support to resources. So if you have COVID, we want to make sure that you're also supporting efforts to ensure that other people get tested, can get identified, and get the resources they need. As we're seeing our trends starting to go in the wrong direction, we're responding on multiple fronts. Again, statewide, we're continuing to build our testing, but also our contact tracing infrastructure. And at the same time, we need to respond to our data and surge additional testing and tracing resources to several targeted communities and populations that have been hardest hit by this virus. Our first round of partnerships is with a mix of several urban population centers as well as some of our rural communities. These include Mecklenburg, Durham, Wake, Forsyth, Duplin, Lee, Johnson, Guilford, and Alamance counties. While these are a few communities that we're working with to surge additional testing and tracing capacity this week, we know there's going to be more. So again, across the state, we want to rapidly increase our testing of people who may have been exposed to COVID-19, but who do not have symptoms. It's important to note that, especially people from historically marginalized populations and those who continue to be disproportionately impacted by this disease. We're also using data to drive our decisions. And we're continuing to refine the data that we collect and how we represent it on our COVID dashboard. So if you go to our website, as Kiera mentioned, at ncdhhs.gov, you can find the latest information about the disease. We have latest guidance, and that guidance is really tailored to your situational needs. We've also just recently released guidance for K-12 schools in North Carolina. We can do much to protect our families and our neighbors, to slow the spread of the virus if we all do our part. This is something we talked about from the very beginning. That's why, phase 2 is really called Safer at Home, because that's what it is. But if you do go out, remember the 3 W's: wear a face covering, wait 6 feet apart, and wash your hands often or use hand sanitizer. So please continue to take care of yourselves. Continue to wear your face coverings to show others your commitment to this, and continue to work across North Carolina to make it a healthier place. And now I'll ask Carolyn Farmer to give us an update on volunteer opportunities in North Carolina. Carolyn?
Good morning. My name is Caroline Farmer. I run the Commission on Volunteerism and Community Service inside the Governor's office. In March, we did our first update with you. At that event, I said that our first priority was preserving lives, and our second priority was preserving livelihoods without jeopardizing lives. I want to amend that, especially for our residents of color. I think we need to do more than preserve. We need to improve. We need to do the hard things to recognize our role in changing outcomes. These past few weeks, I'll be honest, I've been depressed. I've felt powerless in this whole crisis. The brutality, the pandemic, it impacts us all. I cannot pretend to adequately understand how my neighbors of color feel. But I know that I need to learn more. I need to learn about how this is perpetuating. I need to then change, to repent, to walk a different path so that we all can change the outcomes together. You all have chosen to watch this update for a reason. The volunteer work that each of you does can bring people together in a common purpose to help make lives better and fairer. We need to build, to improve opportunities in all communities. Yesterday, I was speaking to a nonprofit leader who happens to also own a few small businesses. He is challenged, many of the other business owners he knows to do what he's doing. He's giving 10% ownership of the business to his employees, the majority of who are people of color. This is change. This is a beginning. It is a place to start. Many of you have volunteered at protests, peaceful protests. You provided a voice that was needed and is still needed. There are many of you who were on the broom brigades, sweeping up, covering up storefronts, and helping. Even yesterday, this help is still happening. The Contemporary Art Museum in downtown Raleigh, within 24 hours, put together a notice about the aging, affordable housing in downtown Raleigh. Those folks don't have access to groceries, drugstores, and so forth because those places have been closed. There were donations that filled up the lobby of the museum. This is who we are. This is the kind of community that we are. We do all of these things. We protest, we help clean up after the protests, we help the neighbors who need help. There have never been a greater need for us to serve. But service won't fix this. It isn't the solution, but instead it's a solution, one of many. Service builds bridges and seeks common ground. It is the work of recovery, and it is the work that we continue to be engaged with as we move forward. In the coming weeks, we'll be offering some virtual volunteer fairs to open up the doors and let you know about the opportunities. If you are interested in being part of that, please email us at volunteernc@nc.gov. We also, in the meantime, we are regularly posting volunteer opportunities to help your neighbors. And I was on a feeding call yesterday where they talked about the concern of volunteers at our food banks. As the food supplies come in, we need to make sure that we have ongoing volunteers in July, August, September, to make sure we are distributing those to the local food banks and food pantries. I want to make sure that you have the ability to serve your community. If you need any assistance, you can see our website is posted there, volunteernc.org. We will have those opportunities posted under the Volunteer Opportunity tab. We also have resources available, donation information, so that you can also be part of it. Collectively, we cannot strengthen our communities in education, healthcare, and economic recovery without addressing the systemic racial bias that exists in our institutions and cultural systems. I need to learn more. We all need to learn more. Please join us to be part of that. Let's continue to rise up and to continue to serve together. Challenge your friends, challenge your neighbors to get out and help others. On behalf of Governor Cooper, thank you very much.
Hello, I'm Jackie Shelton Green, the North Carolina Poet Laureate. Even in times of despair and hopelessness, there is an opportunity to become better as humans and to build stronger communities. Take care of yourselves and each other. Help by following public health protocols. Knowledge is powerful. Learn and know the facts about COVID-19, its risk, and how you can protect yourselves. Social distancing doesn't mean social isolation, but instead it offers a new way of building community. We have survived through many difficult times, and by adhering to the public health practices to prevent the spread and harm that this virus can create, we will make it through this as well, together. For more facts and information about COVID-19, visit www.nc.gov/COVID-19 or call 211.
Good morning, everyone. On behalf of Governor Cooper, Office of Public Engagement, I want to thank everyone for being here, being with us on the call. I want to thank our presenters this morning, Ms. Harris, Mr. Money, Ms. Farmer. We are in the throes of phase 2 of our Safer at Home order, and our Department of Health and Human Service, along with all of our cabinet agencies, are working really hard to make sure that as things reopen, that you all are taking the necessary precautions, but also having access to necessary service and benefits. Some leisure with the reopening of restaurants and the ability to social distance and maybe dine outside. I just want to go through kind of a few things that have been asked online first. First question really about the phases and kind of how we're opening things up as numbers continue to rise. Please understand that, our decision to open things up are not because the numbers are rising. I mean, we made some decisions about reopening things, but with safety precautions and health measures in place that could keep people safe. Clearly, we're watching those numbers every day to make sure that they don't spiral out of control. While we're listening to the science, we're also trying to be responsive to you. And so what folks are saying to the governor and to our Secretary of Health and Human Services, Dr. Mandy Cohen, on a daily basis is, we're trying to balance health with inspiring and invigorating our economy. And there are some trade-offs, which we do value life most of all. And so we are listening to that. We want to be moving into a next phase, but if moving into the next phase is not smart for health, then the governor is going to make decisions accordingly. And so I want to let you know that he is hearing that, and that the entire team is working for kind of a safe and healthier environment for our businesses to thrive, for our students that are experiencing learning at home. This is an opportunity really for everybody to kind of step back and realize that we're all going through some trauma right now. Some of us in our community are going through physical trauma, dealing with COVID-19, and others of us are going through some mental health trauma, just dealing with the effects of COVID-19. As you heard in the 2 messages earlier today, social distancing does not mean social isolation, or I like to say physical distance does not mean social isolation. So we want to remind you of that. We want to remind you that to not be socially isolated, to stay in contact with each other, to look out for your health, that your mental health is critical to your physical health. All the underlying COVID comorbidities, many of them can be the result of stress and those chronic illnesses that can come on by social determinants. And so persons who are living with those things should really be mindful of their health. That is a perfect segue into 2 recent executive orders that the governor has issued. First, Executive Order 143, which establishes the Andrea Harris Economic, Environmental, Health, and Social Equity Task Force. The task force, being led by Secretary of Department of Administration Michelle Sanders, is currently being formed. And this task force is going to kind of examine long-term disparities and seek equitable remedies to address and undo a lot of the systemic inequities in our system that have perpetuated many of these comorbidities. And so I'm really excited about what the governor's done, shown strong leadership in tackling this issue head on. I'm excited about the group of folks that will likely sit on this panel of experts. People ask us about kind of why we do commissions and why we do task force. The idea behind these is not so much to study what the issues are, but to develop a shared agenda about what our priorities are and how we're going to move forward in a really intelligent way. And so look forward to kind of the work of that task force starting very soon. That it has a duty of reporting out to the governor in the next 5 to 6 months. And so this is something that's really important. And what you will see is a real engagement of communities across North Carolina to figure out what our priorities are and what we need to be tackling first. The other two parts of that executive order that are more immediate. One is a provision of health service to uninsured North Carolinians who suffer from these underlying COVID-19 chronic illnesses. And so when the CARES Act funding first came out, you heard a lot of language about money for COVID-19 testing, money for COVID-19 testing, money for tracing. And our health centers said to us, well, it's one thing if we can treat people, if we can give people access to testing, and we want to be testing in all of our communities. But what happens when someone with diabetes comes into the clinic or to the health center and we test them for COVID because they have, a respiratory issue, or their insulin is off? I mean, do we just say, well, we tested you, so you get to leave? And so they, in partnership with the health centers and the health clinic and Department of Health and Human Service and our Office of State Budget Management, the governor's office, and all of our cabinet agencies got some real good guidance out that would allow CARES Act funding, COVID-19 resources that are used for testing and those other services to be extended in use for the services to underlying COVID-19 services. So if you are a North Carolinian living with one of those comorbidities, diabetes, hypertension, high blood pressure, pulmonary illness, asthma, obesity, and you are uninsured, you should go to a free and qualified health clinic, a federally qualified health center, and see a physician. CARES Act funding, we have put in place guidance that will allow CARES Act funding to cover that. Another big provision of Executive Order 143 is the standing up of a small business enterprise project, and that will be run in large part out of the Department of Administration through our North Carolina historically underutilized businesses office. Director Tammy Hall and the rest of the team worked really hard to put language together, and with our Office of State Budget Management, Director Charlie Perouse, to put language together that would allow businesses who are systemically excluded from SBA loans and Paycheck Protection Program and some of our other state-based incentives to access resources and information that can help those businesses, minority businesses, recover equitably. In a data-driven approach, what those entities were saying to us, to state government, is we're applying to the banks, we're applying for the federal stimulus, but we're not getting it. We're getting shut out of the process. And Governor Cooper, again, in a strong show of leadership, said we got to do something about that. We got to fix that. Our hub businesses make up 47% of North Carolina small businesses. 47% of small businesses in North Carolina are hub businesses. And when an overwhelming majority of those businesses are not able to recover equitably, that hurts all of us. And so, again, the establishment of this small business enterprise that will be in partnership with the Rural Center and with Golden Leaf Foundation and with our North Carolina Institute for Minority Economic Development. This is an opportunity to really grow an infrastructure. So right now we've stood up that office and are looking to get more resources to it and allow those businesses that really need help in our rural areas and all across the state, small minority businesses of 100 employees or less, to really just access equitable recovery, not extra, equitable recovery, just a fair seat at the table. And so that, with some other provisions in for the Department of Environmental Quality and our Department of Public Safety, and even for our department, our office, the Office of Public Engagement, the governor has taken a full circle approach at making sure every North Carolinian both understands the equitable needs across the state, but also that we're addressing them proactively. The last executive order I'll talk about is the one that the governor just signed earlier this week. That's Executive Order 145, establishing a criminal justice or a Racial Equity Criminal Justice Task Force. If you have turned the TV on or listened to the radio or been on social media for the last 14 days, you, if not seen the actual video, or you've seen images of the killing of George Floyd in Minneapolis, Minnesota, and it doesn't take very much to understand the connection between that murder and murders that have taken place in North Carolina and across the globe, murder at the hand of law enforcement officers, unarmed, detained African-American men in particular. And the governor, again, in strong leadership, has taken this opportunity to pull together a task force to, again, not figure out what the issues are per se, but to identify the issues and work with a broad, diverse, informed, interdisciplinary group of folks to prioritize what our response to those things should be. In consultation with Secretary Hooks, who's our Secretary of Department of Public Safety, has worked together to give out immediate directives to the Department of Public Safety and all the law enforcement agencies that fall under his leadership. Things like examining arrest procedures, looking at examining when state law enforcement uses force and what cases are appropriate, and examining chokeholds and all these different things that we know disproportionately affect African American and communities of color. In addition to those immediate things, again, I spoke of a racial equity task force that will enlist the help of everyone from our judicial branch to our directly affected population, people who have been in the system, who have adversely experienced the criminal justice system, agencies that work with those communities, our public defenders, our DAs, patrol police officers. Everyone will have a seat at the table to be able to discuss this issue, but then also prioritize what our next steps are. This isn't a task force that's just about talk. Again, the task force can make recommendations to the governor at any point once they're formed by a simple majority vote, but there is a final report that will be due to the governor by December 1st of this year. Again, strong leadership by Governor Cooper and the entire administration in making sure that we all wrap our arms around this. That task force, I failed to say, will be led by Attorney General Josh Stein and North Carolina Associate Supreme Court Justice Anita Earls. Two really strong persons on criminal justice and race. And so looking forward to just the work of that task force, working with that task force, but also working with you, the folks that are on this call, your friends, your neighbors. We want to stay engaged with you. A part of the reason why we do these things, not just the programming, but the decisions that we make, is in response to you. And so when you tell us that there's a need, we try to get on that. Our Department of Health and Human Service just gave some guidance yesterday on testing, the availability of testing, asymptomatic testing. Well, that's because we heard from you that many of you had gone to health clinics and you were told, well, because you didn't have enough symptoms, maybe you just had one COVID symptom but not enough, and somebody said you couldn't get a test. We want you to be able to get a test or have access to a test, whether you're, laying down sick, or maybe you've been around someone else who's sick but you don't have any symptoms. And so we want to be responsive to you. I give you our website every week. I'll give it to you again. It's governor.nc.gov. If you should go to that site, let us know. There's a place there for you to submit comments to the governor. Let us know what we can do to be helpful and be supportive in communities. The governor has taken an approach that we're in this together. He's exactly right. We recover together. We're experiencing the pandemic together of COVID-19. We're also dealing with the realities of the race pandemic together. If we are one North Carolina, if we are one state, then as Dr. Martin Luther King said, what affects one of us directly affects all of us indirectly, that we're tied in this single garment of destiny. And so I appreciate the governor's leadership on this, but not just the governor, all the cabinet secretaries, all the offices in the administration, our state employees who are volunteering on this issue. Over 87,000 state employees. Caroline Farmer mentioned earlier all the volunteerism work that's happening across the state. State government can do so much, but there's a chasm between what state government can do and what individuals and communities have to do to keep our communities thriving. And you guys out there, you're doing that, and we appreciate working with you. We're still in phase 2. There's some talk. We gave some guidance to schools earlier this week, and if anybody would like that information, you can always send us an email requesting that. Our email address is ope@nc.gov. Again, that email address is ope@nc.gov. Let us know if there's guidance for schools that you'd like, or guidance for worship communities that you would like, or faith observances. And if you want more information on either of the task force that I named today, let us know. We'd be happy to send that information to you. In short, and in closing, I would just ask that you take care of yourselves, take care of your families. If you are in a medical desert or food desert and you need help and you need assistance with PPE, I know it's hard to come across, and you've gone to some local folks and maybe they can't help, maybe they're doing the best they can. We want to be a partner. We don't want to come into places and tell people what to do. Our job is to work to build communities across the state, equitably build communities across the state. On behalf of the 75th governor of the state of North Carolina, we are all committed to that. The governor's mission statement from the beginning is to build a North Carolina where people are better educated, where they're healthier, where we have more money in our pockets, and we're free to live more purposeful and abundant lives. And the only way that works is everybody has a fair shot at doing that, and everybody has an equitable stake in doing that. So we thank you for being here. We're going to do this again in 2 weeks. If my math is good enough off the top of my head, that's got to be somewhere around the 25th of June. I think that's June 25th, Thursday, June 25th at 11. We'll have another update. And our prayer is that the science is in a place where we're moving into a phase 3. But I will promise you this, that the governor and Secretary Mandy Cohen and Health Director Betsy Tilson are listening to the science. And if you have ways that we can be listening to the science even more, please let us know. Until that time, I pray for all of your health, all of your safety, and let us know how we can be a better partner. All right. Thank you all. Have a good day.